My name is Dr. Bradshaw, and this tape is intended for my students in RAD 2612. We are covering the congenital anomalies for this course, and tonight I'm doing platybasia. Platybasia is a flattening of the sphenoid and/or occipital bone, and it is determined by four methods of measurements. The first one is Martin's basilar angle, the second one is McGregor's, and the next one is Chamberlain's, and the next one is McRae's. When we are looking at these measurements, we are looking to see primarily is the odontoid process above the edge of the foramen magnum, because we wouldn't want to see the odontoid process up into the foramen magnum where the cord is coming through. Some people consider this an AKA with basilar impression, or also known as basilar invagination. But Yoakum-Monroe does not. It distinguishes between the two by the cause. Platybasia is congenital anomaly, and basilar impression is secondary to pathology. Although it does have the same presentation, this is the way that our textbook distinguishes between the two, but I wanted to mention that to you because there are a lot of people that do use these terms interchangeably. And so I want you to be aware that that might show up on a national board question. If we look at this measurement, you see, of course, that you have 3 points. The first one is at the frontal nasal junction. The second one is at the center of the sella turcica. And the third one is at the anterior part of the foramen magnum. We're measuring the angle on this side. Normal range is 123 to 152. It is when it is greater than 152 that it indicates platybasia and/or basilar impression. The next one is a demonstration of McGregor's line. We use the superior posterior aspect of the hard palate to the lowest or inferiormost aspect of the occipital bone, drawing a line across there, and you see how the dens is sitting below the line, and that's pretty much the way you're going to see normal presentation. The dens well below the line. However, it can be as much as the dens 8 millimeters above the line for males and 10 millimeters above the line for females, and then more than that it would be considered too much and it would be considered abnormal. So again, this one is demonstrating McGregor's. If we look at this film, McGregor's line has been drawn across this film, and the top of, or the point of this arrow is pointing to the top of the odontoid process. Now on this particular film it's too white, but remember that the height of the dens is almost about the height of the vertebral body, so if I look at that, I would be up in this area. Just to give you some feedback for the odontoid process, it's usually about the size of my index finger. Again, it's a little less than the height of the body of C2, and so you're looking for a rounded structure. The arrow is pointing to the tip of the odontoid process, and so you see how much that is above. So this is a demonstrating of platybasia with McGregor's line. This picture is from the textbook. Again, they have marked the top of the odontoid process and how much that odontoid process is above McGregor's line. And so this is an indication of basilar impression or platybasia. Has the same presentation. Again, it is the cause that distinguishes between the two. This concludes the tape on platybasia.